Welcome to another episode of Lessons with Dr. Luke, and thanks for watching. We have a lot of patients that a lot of times ask us, can I have dental implants if I've had cancer? Most of the time the answer is definitely yes. But there are certain situations that people need to be aware of that may change that answer. And a consultation with an oral surgeon or other qualified professionals would be important. A couple medications for bone density can cause problems and have to be dealt with appropriately, or it may lead to problems with the healing on dental implants. Just to mention a few, some that we're seeing problems with occasionally is Prolia, Xgeva, and Xgeva. Those are three that are common after certain types of cancer. And if you've taken any of these or other bone density medications, then it is important to notify your oral surgeon or other dental professionals, including your general dentist, before you have an extraction or any work done on the bone. Dental implants are safe and effective and pretty wonderful in most patients. Make sure you schedule that consultation to get that failing tooth replaced, or if you have a space where a tooth has been missing, have it looked at and return your mouth to its former glory. Remember, Jesus loves you and he loves your teeth, so take good care of them. Thanks for watching.